We're diving into a recent study published in Veterinary Surgery, looking at diagnostic methods for a common cause of urinary incontinence in young dogs, ectopic ureters. These are anatomical abnormalities where the tubes carrying urine from the kidneys, the ureters, don't properly connect to the bladder in the normal position. They can open further down the urinary tract, like in the urethra or vagina. Diagnosis is crucial because the treatment depends on the specific anatomy, particularly whether the ectopic ureter is intramural or extramural. Intramural means the ureter enters the bladder wall normally, but tunnels within the wall to open elsewhere, while extramural means it bypasses the bladder entirely and opens into the distal urinary tract.
And this distinction is really important because a minimally invasive procedure called cystoscopic laser ablation is a good option for intramural ectopic ureters, effectively creating a new opening in the bladder. However, this laser procedure is not suitable for extramural ectopic ureters, and attempting it can risk perforating the urethra. So, getting an accurate diagnosis before or during surgery is vital. Several imaging techniques exist for diagnosing ectopic ureters, including older methods like excretory urography using radiographs or fluoroscopy, ultrasonography, and a more advanced technique called computed tomography excretory urography.
Computed tomography excretory urography, or imaging using computed tomography with contrast medium, is generally considered superior to other methods because it provides detailed images of the ureter morphology in multiple planes, offering enhanced anatomical information. Despite these advantages, it's known that computed tomography excretory urography isn't always perfect at telling the difference between intramural and extramural ectopic ureters. It can also be difficult for it to pinpoint the exact location where the ureter opens. Specialized techniques like using maximum intensity projection or repeated scans can potentially improve accuracy, but they have downsides like needing special equipment or giving higher doses of contrast agent or radiation. Most veterinary surgeons rely on regular computed tomography excretory urography for diagnosis and surgical planning. This study specifically investigated the diagnostic accuracy of routine computed tomography excretory urography by comparing its findings to those from cystoscopy, which involves using a scope to visualize the urinary tract, in dogs suspected of having ectopic ureters. The goal was to understand how well computed tomography predicts the anatomy and the opening location compared to visualization with cystoscopy.
In conclusion, while computed tomography is a useful imaging method for visualizing anatomical structures and investigating upper urinary tract conditions, this study's findings confirm it cannot be relied upon as the sole method for accurately predicting the anatomy of ectopic ureters in dogs. It showed variable accuracy in predicting both the overall anatomy and the specific type of ectopia, intramural versus extramural, as well as the location of the ureteral opening.